When I teach clinicians about dementia, there are two major categories that I'm covering generally. The first is how to assess and/or diagnose someone with a dementia syndrome. And that is a national problem. So many people struggle to find a clinician who will listen to them, who will hear their symptoms and take them seriously and actually follow through with a validated tool, with a structured assessment. And many times there's a care partner or maybe someone who's simply an informant at that time. So someone's spouse, someone's adult child, a person in the patient's life that has direct observation of them. That voice is left out of most clinical interactions. And so I talk to clinicians a lot. We talk about dementia, we talk about bringing in both the voice of the person experiencing symptoms, who may or may not be aware of that, and the person in their life who is observing those symptoms. The other component then, of course, is once someone has that diagnosis, how do you manage them? People also tell horrible stories of getting to a diagnosis after maybe years of trying. They arrive at that moment in the clinician's office and they're told essentially, this is your diagnosis, get your affairs in order. What's next for those people? This is a long journey. Dementia syndrome is anywhere from 8 to 10 years from the time we observe symptoms to end of life. There's a lot of care that needs to happen over that decade. So I talk to clinicians about general primary care, things everyone needs based on their age, based on other chronic conditions. But now you have this context of dementia, which I call a dominant illness. So it's the lens through which you need to manage other things. And then dementia, of course, itself has its own management strategies. Those depend on the stage of illness and the patient's specific needs.